Hey everybody, Tim Wine, physical therapist here at Aspen Rehab in Coral Springs, Florida. Here with our patient David today. We're going to shoot this video on a topic that we're presenting on shoulder problems. David's been kind enough to join us here. We just did David's evaluation, came to us from his orthopedic doctor, and had an MRI. David's been having pain for a number of years now. Went to the doctor, got diagnosed. He's got some rotator cuff issues. There's a subacromial problem under one of the bones in his shoulder, but more importantly, what we found out today and confirmed with the MRI is that David also has frozen shoulder. So these are the things that we see a lot in PT for patients that have pain. I can't move my arm, I can't lift overhead. David didn't necessarily have a trauma or an accident. Lifting may have been a problem. There was a luggage lift that you did that I know kind of aggravated the shoulder, but he's had this problem for a long time. So what we're going to do today is talk about chronic problems. So chronic shoulder pains, this relates to chronic neck pain, chronic back pain, that there is solutions for it. And the trick was what we did today was a very complex evaluation and a proper diagnosis in order to fix the root of the problem. Because even though injections, stretching, massage, and all kinds of other options are out there, for David's case, because of his condition, it's a very specific treatment. So we'll kind of talk about that. So David, tell everybody just kind of like the pain that you've had in your shoulder and how long has this been going on for?
Okay, yeah, the pain is in the left shoulder. It's been there for a long time, but back in December I was lifting some luggage and it seemed like the pain got much worse. Went and had an MRI, and from the MRI they noticed, I thought it would be a rotator cuff, that I would have to get surgery, and they did not recommend surgery. They spoke about a frozen shoulder and sent me here for therapy, and so we're starting that process. I have very limited movement in the left shoulder. As we discussed earlier, probably 30% would be the number, I guess.
Yeah, very limited.
Yeah.
And that's a classic sign of adhesive capsulitis or frozen shoulder, is it's not so much the pain or the rotator cuff, but it's actually the shroud that sits over the ball and socket joint that in David's case has begun to contract and tighten. So injections are great, pain pills are great, but you'll never actually resolve your problem because you have to do a very specific protocol to get that capsule stretched out. And that's the key with physical therapy, is it's a proper evaluation of the root of the issue, because sometimes massage, pills, injections alone don't address those things, so that's what we chat about today. Interestingly, David also has it on his right side, so even though, it's his right side, even though he's here for the left, we took a look at the other shoulder, same numbers, same findings. We realized we have a slight frozen shoulder on the right as well. So we're going to kind of address these issues and really help David get better here. So the key is treatment, compliance, home program. We're going to show David a bunch of stuff to do at home. And it's a combination between the manual therapy we do here, working on the shoulder, as well as educating David on what needs to be done that's really going to help him get the results. So what we've done is we've set David up for therapy over the next 4 weeks. We're going to track and monitor his progress with pure numbers. Numbers don't lie. We're going to look at his range of motion. We'll notice that that pain will actually start to resolve and get better, directly proportional to what your numbers are. So the two big numbers that we look for with David's specific condition, or other shoulder conditions too, is getting the external rotation back on his shoulder, which once we get that, he'll then be able to do the things he can't do now, which is he can't reach overhead.
No,
David gets
hardly.
stuck.
Yeah.
His arm gets stuck, right? The right one's a little bit better, but that's still a little bit stuck too. So 4 weeks, reassessment, check you out, look at the numbers, and then from there we discharge David to a home program and he should be good.
Looking forward to it.
Awesome. Are you ready to work hard?
Absolutely.
That's good. The good news in all this is totally treatable, it's totally fixable. We do these videos because lots of our patients are suffering from neck problems, back problems, shoulder problems. They don't think there's a solution, they don't want to go to the doctor, they definitely don't want to have surgery. I don't know anybody that wants to have surgery, but David and I chatted about this and he was pretty clear, dude, I do not want to have surgery. I'm like, you're going to get better. All you got to do it. So anybody has any questions regarding physical therapy for shoulder, even neck or back, give us a call here. Consultations are free. We don't charge anything for it. go over your case, look at what's going on with you, friends or family that you know may have this. You don't initially need a doctor's prescription for the consultation. Give us a call here, main number 954-341-7875. David, thank you.
Thank you,
All
appreciate
right,
it.
you got it.